So we'll start over. Our total number of cases that we have had from the beginning is 59. The current positive number is 14. The number that have recovered is 40, and we have had 5 deaths. Putting that into percentages, our overall percent positive, that includes all of our staff as well as our residents, was 23% of the people who work here and live here. The percent of those that were positive that have recovered so far is 68%. We have 24% that remain positive, and of those 4 were in our original group back in March. So that puts us at about an 11% continue to test positive at day 49. And we've had 5 deaths, which is a percentage of 8% of our cases. And now as we kind of move forward in figuring out how we are going to coexist with COVID-19, we've begun to take actions to allow us to return to some type of normal. We brought back PT and OT services last week, and that seems to be going well. Physical therapy and occupational therapy.
And speech as well.
And speech therapy as well. Hospice in-person services resumed this week, and that seems to be going well. We are currently working on developing some policies and procedures regarding starting to take new admissions and how we might handle that. And just brief discussions occurred yesterday of starting to allow some small group sessions for meals, where we could have 5 people or less that could have meals together. Of course, appropriately socially distanced, and those individuals would be maintained on the wing that they live in. We're currently developing a permanent isolation unit under the assumption that this likely isn't going to go away anytime in the near future. And that isolation unit will be on 1 East. We've started installing an air handling system that could permit negative pressure capabilities if needed. And some of those rooms, I think 3 or 4, have already been converted for those purposes. And now, as we move toward re-entry prevention, how do we keep it out of the building? We're continuing to do our temperature monitoring at the door with our appropriate infection control questions for anyone entering. We're enforcing appropriate PPE requirements to be maintained at all times. We are going to repeat our staff PCR testing. That's the nasal test you may have heard about. That's going to happen on Thursday of next week. Staff. That will be our 2-month mark. So they were screened at time 0. We did it at April 22nd roughly, and then we're going to repeat that next week, and that'll be the 2-month mark. And of course, we've continued our aggressive infection control efforts, and our environmental staff services people have done a fantastic job with that. Now we'll turn our attention to where we are in terms of screening and testing for the building for our residents. 2 West, 1 West, 2 South, and 1 South have all tested negative.
Can you say that again?
Sure. The west corridors of the building and the South Tower have tested negative now for 3 consecutive times. And those are separated by a week each. So we are finished in this moment doing that type of testing on them, which is the PCR test, the nasal swab. We have also collected blood samples on the entire west side of the building and the South Tower. And we're looking at the serologies now. That's the antibody testing you may hear about. Now we turn our attention to the east side. 1 East remains our isolation unit, and the people who are positive get tested weekly. That happens on Mondays and will continue until we don't have any positives. The 2 East side, we have 2 more times that we need to test them with PCR before we feel good that we're not going to pick up any new cases there. We have also done the blood test, antibody testing on the 2 East residents as well.
2 East is where the COVID patients are.
1 East.
1 East.
Yes.
And 2 East is?
That's where we've picked up, if you recall, it seemed to be where the majority of our positives were initially. And then when we did the rescreening for the governor's mandate, the majority, 7 of 9, were picked up there. And then when we did another screening a week later, we picked up 4 new cases. That's 2 East. Okay. So that we're going to continue to test them this coming Wednesday and the following Wednesday. We've also collected serology samples on that population as well, the antibody test. On Monday, we're going to collect antibody testing on our isolation unit.
1 East.
1 East. And I feel like we have enough information back at this moment with the antibody screening that we can start to draw some conclusions. Some of it is not as clear as you'd like, but I think it would be useful in this moment to move forward with our patients, especially those 4 individuals who've been positive for 49 days. I think we need to be able to look at their serology. Those are all patients. Yes, our last employee cleared at day 49 that we tested. The last one that was positive for that length of time.
So there are four originals are still.
4 original of the original group. Correct.
Are they still on facility?
They are. Every patient is here. We don't have any hospitalized anymore.
What about the patient with dementia?
He has tested negative, and we've also done serology on him, and he demonstrates immunity, and he's back with us. We brought him home this week. Just the last thing I have to say before we take questions is that, you know, we need to really continue to express our gratitude to the people who've helped us. I feel like, you know, we're really ahead of the curve, and it's because of the support that we have gotten from the folks at WVU Medicine, the people who've really gone above and beyond, Nathan Burt, Darren Rogers, Pete Parada, Troy Krupika. They have been superb. Mon Health System, Greg Nelkamp, Laura Evans has been a tremendous help to us. LabCorp, Randy Murdoch, Shelby Neri, again, really helped us get supplies, made this serology testing available to us. And so we were really grateful to those people. The Mon County Health Department, Dr. Lee Smith and his staff continued to provide tremendous support. And our DHHR, from the local level clear to the state level, Secretary Crouch has always been available to us if we had questions or just calling to check and see how we were doing. And really, most importantly, to our family members and our staff who just continued to do a tremendous job and really, in my opinion, they've taught this country how to do this in a nursing home setting. So I was extremely grateful to them and their continued tireless efforts.
When can patients visit with their family?
Yeah, we had hoped to do this over the Mother's Day weekend, and it's been, you know, since March 12th, since many people have gotten to see their loved ones. And you know, so we're 2 months and counting, and people are very excited to visit. And you know, the socially distancing thing was difficult for us to enforce, and when we were unable to do that, we had to tap the brake on those visitations and kind of rethink how we do it. This week has been extremely busy for us in terms of collecting samples, blood samples and nasopharyngeal samples, and coordinating our efforts to really see the status of our building and get our arms around it. I would think we'll be able to sit down next week and start to have a conversation as to how we can safely allow these types of things to occur. You know, today someone forwarded me a picture of actually a visitation booth that a facility had built, where they could bring the person outside and sit in it, almost designed like an old school concession stand with a sliding glass, and the person could sit there and the other person was on the other side, and it kind of forced the appropriate distancing. And maybe we could do something like that, I'm not sure, but it's our goal to allow these folks to see their families and for visitation to occur when we can accomplish it safely for the residents and our community.
Now, since it's been so long, how's the morale? You know, how's everyone doing, from staff to residents?
You know, we've had, in my opinion, 2 really good weeks. When we're starting to see the data come back in where our numbers are dropping, our patients who are still positive are doing really well. And we have gotten everyone home now. There's no one hospitalized. And I think that's gone a long way in maintaining morale.
It's amazing to me how much the staff, this has kind of galvanized our staff to an extent. You know, I mean, using some of the metaphors from Governor Justice, you know, we're all in the same boat, and we're also pulling the rope in the same direction. So if he would allow me to mix them, I would certainly love to do that. The morale is great, and when you finally start to get some good news, when residents are coming back, more people are testing negative. That is such a bump to everybody, and it's I just cannot say enough about our staff and Dr. Schrader as well. He's handing out all the accolades, but this man has been here every day since this started, and it's just absolutely amazing. Completely a tireless effort on his part. You've done well, Swabby.
How many patients do you have now, or residents, Bobby?
You know, I don't know the exact number. That's in the upper 80s.
Upper 80s?
Yeah.
So,
The last number I saw was 87 or 88.
what can I see in the paper?
I would think 87 is safe, right?
I'd say 84.
It's 84. There's the exact number.
Now, you mentioned earlier that one of the things you're looking at for the near future is trying to see if you can get new patients or residents, I should say, in here. How is that looking? Are there a lot of people trying to get in here, or are you kind of playing it by ear like you're doing with visitation?
Well, you know, we do have a couple people who've been waiting to come in. And for us, it was most important that we felt good that we could offer a safe environment for those people to enter, where we really understood what we had and what our status was. And for the first time, really since the beginning of this, I feel very confident in saying what our status is, and feeling very good about being able to bring someone in and keeping them safe. And so we're ready to move forward with that. The process is going to be, we're going to require a swab to show that they're COVID negative upon entry, and we're going to keep those people isolated for 2 weeks and re-swab them again to just make sure we're not bringing in new cases to the facility. We'll start that process next week.
When was your last case of COVID?
So this is almost a trick question. Well, as we're gathering more and more data, I'll be prepared to talk to you more about this maybe next week. But just to share with you what we're seeing, we all knew that maybe we didn't know where all the COVID patients were through traditional testing with the nasal swab. As we've drawn blood samples, we have identified people who were never PCR positive who now seem to demonstrate immunity. We're trying to make sense of some of that. It's not a tremendous number, but it's happened. And so when you ask me when was our latest case,
Last diagnosed.
right, so we had 2 people who were positive for 42 days and beyond, and they may have gone to the hospital for an evaluation or something and got a re-swabbing and then popped positive again after being negative. But when you combine that with their serology for the antibodies, they demonstrated immunity, meaning IgG positive, what we believe to demonstrate immunity. And then we retested them and they were negative again. So could they continue to shed small particles of RNA? Absolutely, that could go on for a while. So we had someone 1 week ago on Wednesday to demonstrate some equivocal results or indeterminate results. We repeated that person this Wednesday, but we also repeated the PCR with the blood test for antibodies. And that person demonstrates immunity where they have the IgG type antibody. So, you know, full disclosure, would that be our last positive PCR? Yes. Is that technically the last case we saw? We could say that. But for all practical purposes, that person has recovered and is demonstrating immunity. Yeah.
So you're going to begin looking at taking in new residents next week?
We are.
How many?
1. We're going to start slow. We're going to see how that goes. There is a young lady here who's been waiting on her husband to join her for quite some time, and he's eager to come and live with her, and so we're going to see if we can't bring them together.
Ever the matchmaker?
Yes, yes. And then, you know, we'll start working with the health systems. You know, again, we have a tremendous amount of data to organize and review. But we're at a point now where we can start that process.
Okay.
You guys have made a lot of changes to adapt to this new environment. How many of those changes that you've implemented do you see sticking around in more of a permanent fashion?
I don't think there's any of them really that's going to go away. We have relaxed vital signs. We were doing those every 4 hours when this started, and that's simply not sustainable. So we've relaxed those down to every shift. And, the disposable meal preparation, putting them on disposable trays and so on, is something that I could see going away in the future as well. And we do want to start to bring people back together in the dining area to visit with one another in a safe way for many different reasons. You could imagine how difficult it is from a staffing standpoint when they're isolated in their rooms, and how many of them need assistance with meals, right? But if you were able to put them in a common area, well, one aide then could help multiple people with their meals. It would allow them to socialize. So those are the types of things that would really perhaps go away. Like the aggressive vital checks every 4 hours have gone away already, and how we serve our meals and that type of thing is going to be altered. But for the most part, they're here to stay.
How happy are the residents to be able to be outside?
Oh, this. I've been coming to Sundale for nearly 10 years, either as a resident and training as an attending physician, and it's amazing how something like this brings us all together. And their mood right now as we're recovering and being able to come outside and being able to do more things is just heartwarming, to say the least. And I've gotten to know them, and I come in on the weekends and round just to check on everyone. And this past weekend, this lady was coming down the hall on her chair, and she said, "Dr. Schrader, I just want to tell you how much I love you." And that just means the world, to see how people are rallying around. And it could be the other way around too. People could be resentful and really angry that they have been isolated for nearly 2 months, but it's just not been that way. And again, that goes back to a testament to our staff. We're going to respond to the way our environment is, and if we maintain a positive attitude and a supportive one and a caring one, that's going to be reciprocated, and that's what I've seen.
Just marvelous.
Thank you.
Yeah, you're welcome. Thank you. Thank you.